Welcome to Unit 1, Section 2A, Subjective Information Influencing Treatment Planning and When to Refer a Client. So you've looked at potential factors that influence injury, recovery and repair and touched on why it's important. The factors discussed in the previous lecture are collected on the first consultation with your client, and these all go under the client-related details. So as you are aware, you will be collecting things like age, gender, general exercise levels and sporting activities, medical conditions and medicine, hobbies, work, general lifestyle, and so on. These basic pieces of information are the foundation of the knowledge you will need to create a good treatment plan and help prevent further issues. The more sensitive parts of this information don't always come out on your client's first visit. You may feel the client hasn't divulged everything, and it may be a while before you can confirm any suspicions you may have. For example, things like eating disorders and steroid use and so forth. This sort of information generally only comes when the client trusts you and you have built a professional relationship with them. They may never tell you. The next section of subjective information is about the condition itself. Again, this is the same as the Level 3 basic subjective history. This basic information is so important I can't stress it enough. So this gives you your reason for visit, how it happened, when it happened, what happened and so on. This gives you an understanding of the issue and the factors surrounding it. Over time with this section you will get better at asking the right questions and finding the information you need. Like massage itself, it comes with practice. Within the subjective conversation you can find out additional subjective information that will help you plan treatment and rehab. This will include the client's expectations towards treatment and recovery, possible barriers affecting recovery, the client's attitude towards treatment and rehab, and whether they will adhere to it. This is all your subjective information, and all this will heavily influence your investigative direction, treatment, rehab, and guidance, including if you feel that you need to refer them. Without this information, you will not have a starting point. Occasionally at this point or further into the consultation or potentially several treatments later, you may need to refer or defer a client. What do we mean by that? A referral is when you pass the client onto a different discipline. This could be the physiotherapist or GP. Deferral is when you delay treatment. This could be because you are waiting for information from another practitioner or permission to treat from a GP. Again, this has been covered in Level 3 and there is quite a list of possible reasons to refer or defer someone, including but not limited to medical conditions, the client or therapist has a specific concern, if there is no improvement after treatment, if there is a deep-seated joint pain that doesn't improve or a mechanical block, if the pain or condition gets worse, and if you as a therapist have any doubts. Be aware here that sometimes clients will push you to treat. If you don't feel that you should treat, don't treat. I have had an incident where a client with a lot of medical conditions insisted I treated him and I refused. And a few months later he had another heart attack. This could have been laid blame at my door if I hadn't been persistent in not treating him. In many cases, the client will be referred back to you when appropriate, especially if you have built your network of practitioners. When deciding to refer someone, you need to employ a degree of common sense. If they have a medical condition that is well managed and the GP is happy with them, then you can treat, bearing in mind the condition when you treat. If it is a new condition and all over the place, then you can't treat. They may have been referred to you in the first place, so although you should always do your own due diligence, if they have been referred by a physiotherapist or GP, then you are more likely to be able to treat. I have several GPs that will refer to me. Sometimes I will have to refer them back to the GP, but not often. So this completes Section 2 of Unit 1. You can now complete the quiz and move on to the effects of anatomy, physiology and pathology on human function.